Hi Bespoke Babes, it's Dr. Kim. So you've probably seen all of the pictures we've been posting of lip filler. It is huge right now, so popular. I have done so much lip filler in the last few weeks. But despite the popularity of lip filler and lips in general, that's why we've got our golden lips up there, some clients come in and they are worried that they're gonna look ducky, that it's gonna be too much, that they're gonna have that protruding upper lip. And all they really want is more red lip showing without any sort of puffiness or protrusion of the lip, just definition and more red lip. So there are 3 ways we can do that for you. Well, 4 actually, so we call that a lip flip, where we're just flipping up the edge of the red lip to get more lip showing as opposed to more volume. So the first way we can do that, of course, is with Tox. We can do pretty much anything with Tox. If we're doing it with Botox, Dysport, Xeomin, or New Tox, we're only putting a few units in, usually 4 to 6 units in total. It weakens the muscle and flips it up. So the advantage to that is that it's very affordable, it's easy, there's no downtime, but it only lasts maybe 6 to 8 weeks. It tends to wear off quite quickly, and you can feel like you're not speaking properly because we are weakening that upper lip. So sometimes women report that they feel like they can't use a straw or they're not speaking properly. But it's easy, relatively inexpensive. The next way we can do it is with filler. And I take the filler, and instead of going into the red lip, we're putting the filler just into that line, what we call the vermilion border, where you have a junction between your red lip and your regular skin. And when we accentuate that vermilion border and lift it up with our filler, then we can increase the red lip showing without increasing the protrusion. So that's with filler. It lasts longer, of course, than our Botox lip flip. The filler can last 6 to 9 months, sometimes up to a year. However, there is a risk of the filler migrating or moving out of that vermilion border, either down into the red lip or up above the lip. So if you don't want to risk it and you want to make sure it's just that crisp lip line, then the final way we can do it is with our threads, our PDO thread. So this is a technique where I use this dissolvable suture called PDO, and we do a thread lift along that border in the same way that we would do it with filler, but this time I'm using threads. The threads won't migrate and they will not give protrusion to the lip. They will simply lift it up and give us a really crisp definition of that lip line without creating duckiness. The threads themselves are dissolvable and they dissolve away over approximately 6 months or so. But as they're dissolving, the body is producing collagen. They're a biostimulator, and that collagen is going to last for a couple of years, basically, until it breaks down again. So that means we have minimal downtime, we have longevity, they don't interfere with the way that you speak, and there's no, minimal chance of migration with those threads. The final way that I didn't put on the board is actually surgical, which is a surgical lip, but that of course has significantly more downtime associated with it. So our 3 most popular are Tox, filler, and threads. And of those 3, I would say that the threads are the ones that are really catching on because they're so precise and they give us that really nice defined lip. So that is it for lip flip. And as usual, if you have any questions, post them or message me. We are open on Saturdays throughout the summer. So if you want a Saturday thread lip flip, give us a call and we'll fit you in. Have a great day, Bespoke Babes.